one way to deal with obesity that has skyrocketed in popularity is GLP-1 drugs. Now, by now, you're familiar with GLP-1s like Ozempic, Mounjaro, Wegovy, the list goes on and on. It seems like new studies come out every couple of weeks on these drugs, and now there's some good news with the latest study. So it turns out researchers say GLP-1 drugs may improve cognition, lower dementia, and the risk for cardiovascular disease. Okay, but with that said, there are still some serious risks. So joining me now is Dr. Sonal Haerter with Dignity Health Medical Group, and she's also a board-certified obesity specialist. This is interesting. Tell us more about this new study.
Okay, so this study involved 2 million diabetic patients. And what they did was they went through health records for about 4 years. And they divided these patients in two groups, patients who were on GLP medications for the diabetes treatment and people who were on traditional diabetic medications for their treatment. And then they looked at about 175 health outcomes. And what they noticed was patients who were on these GLP medications had reduced health conditions, about 42 health conditions reduced on these medications, and there were 19 that actually got worse. So now we know that these medications are not just beneficial for diabetes and obesity, but also in certain conditions like dementia, Alzheimer's, reduces the risk of dementia, Alzheimer's, cardiovascular, 9% reduction in heart attack and cardiac arrest on these medications, also reduction in suicidal ideations, bulimia, and so seizures, substance use disorders. So those were some of the benefits that actually were noticed in this study. I also have to add like reduction in pneumonia and COPD and certain infections.
That really is incredible. I mean, it sounds like kind of, the magic drug. However, like anything, right? There's gonna be some risks. And we have heard a lot of risks in the past before, but let's remind our viewers again what these risks entail.
Right, so I think most commonly discussed and noticed are gastrointestinal side effects like nausea, vomiting, constipation or diarrhea, also gastroparesis or stomach paralysis, also kidney stones. It's increased risk of kidney stones. We saw some headaches, some joint pain, tendinitis. So these were some conditions that also got worsened. Certain sleep disorders got worse in the study based on observational data so far.
Okay, so again, you got to be mindful of both. There is good, there is bad. Now, obviously, as we've talked so many times before, the cost. It has always been such an issue with so many people and patients, as well as these drugs. But if you have certain conditions, could at least it be partly covered by insurance? What would these conditions be?
So at this point, FDA approves the use of these medications for type 2 diabetes, for obesity, for cardiovascular diseases, as well as sleep apnea.
That's kind of new, isn't it?
That is a new recommendation for Zepbound is approved for sleep apnea. Having said that, the insurance coverage is still kind of not clear on, for certain conditions. So you still have to go through your insurance and see what your copay is, which ones are covered.
Right, and I always preface it by saying partially covered because people think, because they can run up to $1,000 a month.
Oh, they are over
$1,200
out of pocket. And with insurance coverage, they can go anywhere between $50 to $250. So really depends on what your insurance coverage is.
Right. Okay. So, start of the new year, a lot of people, they've got health, they've got diets on their minds, they want to start something new. But I think it's important to distinguish, a lot of times people could see these GLP-1s as like, again, the magic drug to lose maybe 10 or 15 pounds or what have you. What is your advice to people who look at it like that? Who should take it and who should not?
And this is not medical advice to everyone. This is just what I observe in how we do this, right? Number one, those 10 to 15 pounds or any weight loss has to be taken in context of your other medical conditions. For example, do you have diabetes? Do you have obesity or obesity-related complications? Do you have hypertension because of your weight problems? Do you have sleep apnea and weight problems? So these are people who actually traditionally qualify for these medications. And as we all know, these medications do have some serious risks and complications. So obviously, those benefits and risks need to be weighed, and your overall health needs to be considered before starting these medications.
Okay, great advice. Thank you so very much, Dr. Sonal Haerter. We always enjoy having you here.